Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine Podcast. I'm your host, Yaron Ivan, as usual, and today some more important clinical care tips that hopefully will help you take care of your patients. Rule number 212. Always compare both sides on your physical exam. So again, as usual, always good to give examples. Many years ago, when I was in my residency, I think it was first or second year, I was seeing a patient that the mother brought to the pediatric emergency medicine department because she noticed some kind of weird bump or swelling over the head. I think the baby was about 4, 5, or 6 months old, and I remember palpating the patient's head and also being kind of puzzled by this weird swelling area. It didn't feel boggy, it really felt like part of the bone, which made me kind of curious of my next step. What am I going to do? Is there a head tumor or a bony tumor in the skull? That makes very little sense. Even back then I knew that. So I was really kind of puzzled. I remember presenting my patient to my attending, who immediately say, "Yaron, did you feel the other side?" Needless to say, I felt a little stupid and a little sheepish, went back to the room, examined the patient a little bit more carefully, and lo and behold, the patient has the exact same swelling on the other side of the head. In other words, that is just that shape of this baby's head. There was nothing pathological, the exam was totally symmetrical, which makes it less likely to be anything serious or pathological at all. It was then when I learned that when there's any concern on any physical exam finding on one side, always inspect the other side. This goes back to one of my other rules that when something is bilateral, it's usually less concerning. The classic example is the teenager that comes to the emergency room with bilateral knee pain that doesn't sound like it's inflammatory pain and the patient otherwise has a decent exam. I always worry if there's osteosarcoma or some other bone tumor. If I recall correctly from my medical school days, bony tumors are most common in the distal femur, proximal tibia, aka around the knee. I always inspect the other side, and if I feel something on the other side, under those circumstances, if the patient is complaining of bilateral knee pain, I am significantly less concerned about tumor. I think it's very unlikely that the patient will have bilateral tumors in the knees on both sides developing at the same time. So anything that is bilateral always makes me a little less concerned. The classic example, as everybody knows, is the abdominal pain on both sides. It's very hard to have abdominal pain on both sides to the same degree with appendicitis, with the surgical abdomen, with ovarian torsion, etc. So remember rule number 212. Always compare both sides on your physical exam. Rule number 213. Check out the fast track. Sometimes. So really this rule did not occur to me until I got to my fellowship at the Children's Hospital of Pittsburgh. So in Pittsburgh, there are fellows, there are attendings, there are residents. It's a very busy ER, and there's also, right at the end of the hallway, fast track. And as a pediatric emergency medicine fellow, I never thought too much about it. I'm here to see sick kids, I want to learn intensive care, I want to learn how to resuscitate and how to intubate. And I quickly learned that while those skills are very important, almost no matter where you go, most of what you'll see is bread and butter pediatric emergency medicine. And seeing patients in fast track is often very, very valuable. Most of what we see, no matter where we go, is of low acuity, that is sort of in and out, and the patient is well. Those are the exact same patients you see in fast track. Believe it or not, and as much as we don't want to think that, low acuity cases are very educational and they often provide some good procedural skills. So many times the nursemaids, the small lacerations, etc. don't even make it to the main ER if you work in such ER, and they often go to fast track. So this is for you trainees out there. If you work in an ER, if you're training in an ER that has fast track, check out the fast track, check out the procedures, and get comfortable with those bread and butter pediatric sort of stuff. Again, nursemaids, suturing, URIs, things that you're very likely to see no matter what pediatric career you're choosing, will be very helpful to see in fast track, and that's why you should get that experience. From an attending standpoint, it wasn't until I became an attending when I realized fast track is very challenging. I often tell the residents, and it's one of my rules, the sicker the child, the easier it is. When a sick patient comes to the ED, I have a lot of help, I have a lot of consultations, and I have a lot of time. Fast track is often very different. It's a lot of in and out. It's very, very high turnover, which if you don't have a good EMR makes it even more challenging. And I can't tell you how appreciative my PAs and my general pediatricians and my NPs are when I go and help them in fast track. This is especially true if I have a resident or a fellow on shift and they can help managing the main ER, seeing patients, and get them started while I help in fast track. Fast track is often very challenging due to the high turnover. And again, if you don't have a good EMR, certainly if you don't have a good dictation system, that can be very challenging. I think my PAs and NPs are often very, very grateful when we help them in fast track. So as a trainee, I recommend working and checking out the fast track to get some bread and butter pediatric experience and also to train with high turnover. As an attending, I really recommend working in fast track as a collegial act to help your fellow PAs, NPs, or whoever is working there. It's often very challenging because of the high turnover. Rule number 214. Don't let that normal blood pressure fool you. I think this is a rule that most of us who work with kids know and learn quite early in medical school. Kids have normal blood pressure until the very end. And this comes back to really basic pathophysiology. Simply put, blood pressure is basically a window to our cardiac output, which is the amount of blood pumped by the heart, maintaining that pressure, and cardiac output is a sum of the stroke volume times the heart rate. As we know, kids can become very tachycardic. Young, healthy hearts can maintain the tachycardia very well, which means the cardiac output is often maintained for a very long time, despite the severe sepsis, despite the severe shock, etc. We all know the term compensated shock, etc. And oftentimes, while the patient is in compensating shock, he or she have very normal blood pressure. As I explained before, however, tachycardia, especially unexplained tachycardia, when the patient is not crying, not febrile, is a very big red flag. And I see a lot of my general ER physicians often get very reassured by the fact that the patient has a normal blood pressure. Don't let that normal blood pressure fool you. Remember, cardiac output is maintained by the heart rate and the stroke volume. Kids do a great job maintaining the heart rate. They can maintain it very high for a very long time and tolerate it, which is why the blood pressure is often very normal for a very long time. But once that deterioration is coming, it's coming and it's coming fast. So I absolutely advise everybody to look at the vital signs, but do not let the normal blood pressure reassure you in a patient that is in the pediatric ER. And that is it for today, guys. Thank you very much for listening to PEM Rules. Thank you for supporting me and thank you for checking out the website. I'm reminding you, PEM Rules now has a PEM Rules store, which you can get a link to from our website. And there's also a Facebook page, which I'm trying to build slowly with some educational material. So make sure you check the Facebook page and become a follower. Check out the PEM Rules store, a link of which you can find on the main page of the website, and continue to communicate. I love hearing from you guys. If there's a topic you want to hear, if there's an episode you liked specifically, any feedback is welcome. And again, if you're a trainee interested in some scholarly activity, namely coming on a podcast to discuss any PEM-related topic, consider yourself invited to PEM Rules. Thanks again for listening, and this outro is dedicated to all the Superman fans out there. I was a young child when those movies came out with Christopher Reeve. Great experience, never gonna forget them. This is taken directly from the soundtrack, inspired by the upcoming movie Superman that is coming out, I think, in July of 2025. Thanks again for listening and have a great day.